Okay, so this is a patient with Alagille syndrome. It's a autosomal recessive condition that predisposes them to cholestasis. It involved other systems too, but I had 2 cases of Alagille syndrome in 1 month, and I didn't know what that was, so wanted to share with you guys, and also a little bit of a consult to see what you think. So the hepatology people, they had been following her for this liver mass, which was a presumed adenoma, and I came across this case last week, and I didn't think it was an adenoma. So anyway, so here we have, it's T2 dark, and you know, on the in and opposed phase, the signal increases. So there's the in phase, opposed phase, and the signal increases. So there's some kind of like iron deposition, and there's no restricted diffusion, and there's on the arterial phase there's no enhancement, and then portovenous phase, you know, it just looks iso-intense to the background liver. So before I saw the in and opposed phase, I'm like, oh, it's a giant focal fat or something like that, because it, you know, but then because of the signal increase, I was thinking along maybe like a giant siderotic nodule. I don't know. What do you guys think? Because I have another case that looks just like this, Alagille syndrome, that I'm going to show you as a companion case. But I mean, I didn't think it was an adenoma, and it's been growing over time, but they've just been watching it.
Wait, can you tell us about Alagille syndrome? Like, what is that? What is it?
It's a recessive, here, can you see my screen?
Oh, Alagille.
Sorry, bad.
Alagille. Oh, Alagille.
What? Someone sounded like they knew what this was.
Yeah. Yeah, they get cirrhosis with this syndrome, I think.
Yeah. They get
it sometimes because they can get hepatocellular cancers, or is it true?
It's no. So I did some Google search because I was like, I think HCC is rare, and this is a case report that I found on PubMed. They usually get liver lesions, but not typically HCC. And this mass that I saw didn't look like HCC or adenoma, which I think was the leading diagnosis that the hepatologist had been following the patient for. I thought it was like a siderotic nodule because like the signal increased on the post phase. I don't know. What do you guys think?
Hey, this is Matt. I have a couple questions. Do you know if they did any iron studies on the patient, like systemic iron studies? And then also, was it ever biopsied?
It was not biopsied, and I don't know about the iron study, but I can look it up. I'm going to show you another companion case that I saw in the same month, and it looks just like this. And I was, let's see if I can.
And these patients generally get follow-up over years. So I remember seeing one many years back. But so you should have a comparison imaging for this patient.
Yeah, this patient. No, we have multiple images in the past, and it looks exactly the same. It's just increasing in size.
Why don't they want to biopsy it?
Why don't they want to biopsy?
Yeah.
I don't know. Sometimes I'm a little surprised, and I'm like a lot more aggressive now about recommending biopsy, which is what I did in this case. Oh, here, let me share the other video. On my other screen. Sorry. So let me see how do I do this. Share. Okay, let me unshare this. Sorry, I'm working on 2 computers, my PAC system and then my laptop. That's the confusion. So anyways, here's another case that I saw in the same month. Same diagnosis, a younger patient. This one's 32, I think. The other one was older. I mean, but still young. So this one has multiple liver lesion, and it's like same characteristics. Like this one was growing, but the other ones were mostly stable. There's no restricted diffusion, and then there's like no. I mean, some of them may have a little bit of enhancement, but most of them, had no enhancement. And
If you Google this Alagille syndrome liver imaging, you go to images.
Yeah.
I found several like where it says central macro-regenerative nodule is characteristic of Alagille syndrome.
Yeah.
And it looks like your case. Like it looks like a
nodules.
T2 dark. Well, one of them has like a large central T2 dark nodule. Another one has multiple nodules. Another one's a 3-year-old that had a large regenerative nodule.
How come the signal increases on a post-phase imaging? Do regenerative nodules do that?
Yeah, they can.
Oh, okay.
Nelly, has anybody tried to do
phase, right? Not the post phase.
I'm sorry, on a post phase. My bad. Yeah. Sorry.
Nelly, did you try to use EVIS for these cases? I'm just curious. Because if they're regenerative nodules, that will just be.
That's a good point. We don't use EVIS very much at Loma Linda, and I guess it's because it costs like $300 or $400 for EVIS, whereas it's like under $100 for multi-hands. I think it has to do with a contractual thing. So they don't do a lot of EVIS here. I mean, at Loma Linda. So this was not done with EVIS. It was done with multi-hands, but maybe I'll add an addendum and ask them to do with EVIS next time.
Yeah, there is a case report or a study from Pediatric Radiology Journal from 2017.
Yeah.
Saying that these were isointense to liver on T1, hyper on T2 on few, but they also say that they were hypointense on T2 weighted imaging. So, as Aarti was saying, probably fits in with the diagnosis.
Of regenerative.
There's a bunch of cases of children, so it seems like they're being followed. Probably more in the pediatric population.
Okay, cool. So regenerative nodules. That's what you guys think.